Hi guys, good evening. Can you all see me and hear me? All right. So good evening and welcome to ENT class. So today again lots to do. So this is I can't find a PDF. I posted it on the group. Just somebody just posted it again. Thank you, thank you so much. And it's been so hectic actually for me. Just struggling to manage everything at the moment. Everything has come together. I think cerebellum and neurons and God knows what all. And plus I have to read. Read ENT and then I have to see Zara and so I am like right now there's everything's a big mess. But and again like taking out time to read in the middle of all of this, I am reading trying to understand ear anatomy and I am like thinking, God, what is going on? So ear anatomy is something which I have always hated, and today is finally the day that I just read it, and the kind of questions that you're getting are not just simple middle ear anatomy, that this is anterior, this is posterior. They're actually giving you endoscopy images and microscopy images, and I mean, it's just so weird. So I was actually thinking whether it's high yield also, because every time you prepare something and they'll give you some very odd image. So I've just included the ones which I feel are important. I've tried to go through any possible resource that they can actually ask it from. अब इसके ऊपर भी आया तो I don't know, just leave that question. I don't know कौन ही किसको ही आता होगा. So that is what. So I'll try to cover whatever is important. हाँ, I am actually studying more than you guys, and then when you guys panic ना कि मैम ये हमसे पढ़ाई नहीं हो रही, ये नहीं हो रही, then I feel very angry कि पढ़ लो चुपचाप. So this is ENT rapid revision. Alright, so we're going to be doing ear and nose today, and then we have larynx and pharynx, which is going to be done tomorrow. So pediatrics के जो PYQs रहते थे ना, we'll do it tomorrow, right? So tomorrow all the MCQs, like because today's PDF is very bulky, 97 है. हाँ, बस खाली इतना कर लो. For all the short subjects at least, you can rely completely on what I am teaching. Obviously pediatrics is a large subject, right? So you'll have to do other extra classes which I have told you, but still that is something that will suffice for the most important things which is there. PDF I've already posted on the group. Somebody just pin it or do something, no, post it again. ठीक है. हाँ. ओके. हाँ, आई एम गोइंग टू गिव द एग्जाम. आई एम थिंकिंग अब मैंने इतना पढ़ा ही है बट आई डोंट नो फिर रैंक का क्या करेंगे. आई माइट डू पैथ अगेन, आई गेस. I can become a rad path person in one. Okay, let's begin then. Lots to do. So we'll start off with nose and PNS to keep it a bit light, and then we'll go to ear, which is a bit toxic, है ना? तो अभी nose and PNS कर लेते हैं. Seat मत ले जाओ. हाँ, ठीक है, ये भी fair enough. Okay, chalo. What do we have here? So all the named X-ray is one question you get in INI-CT for sure. So this is something you can't get wrong. What is this X-ray view? Double PG is apparently allowed. I have just found out, but I'm not gonna do. Okay. What is this? Yeah, this is Waters view, or is this a modified Waters view? So the better answer would be that this is a modified Waters view, because we're seeing that the mouth is open, right? So whenever we have an open mouth Waters, we either call it by the name of Pierce view, or we call it open mouth Waters, or we can also call it modified Waters. अगर माउथ बंद है तो कॉल इट नॉर्मल वाटर्स. अगर ऑप्शन में इनमें से कुछ नहीं दिया, they give waters only, then mark waters, so you got the train of thought. If peers is there in the option or this is there in the option, this is better. अगर ये ऑप्शन में नहीं है, खाली waters लिखा है, तो mark that. Okay, so this is about that, where the mouth is open. Yeah, just started. So this is taken how? So we have the chin in contact with the image receptor, right? So this is how the X-ray is passing from the occiput to the mentum, to the chin. So what is this called? Yeah, so the view is also called as occipitomental view. So if they want to make it tougher for you, this is the name that they will use, right? So you are always getting questions on this. So now they will like go away from Pierce to occipitomental. This would be a future question, okay? So this is occipitomental view, which is the sinus which is best seen here. As you can see, these are the maxillary sinuses which are oriented in the field. These are seen best here. So this is the best for maxillary sinus. In this particular patient, are these maxillary sinuses normal or are they abnormal? Yes, there is definitely sinusitis, right? You can see air fluid level. There is this opacity here. So opacification of sinuses suggestive of sinusitis, isn't it? What are the sinuses you don't see here? Frontal फिर भी दिख जाता है, anterior ethmoidal फिर भी दिख जाता है, sphenoid we can see because the mouth is open. The one sinus we can never see is posterior ethmoid, right? So remember, the sinus which is not seen here is posterior ethmoid. Why we are seeing sphenoid is because mouth open रखा ना, तो पीछे से दिख गया. That is the whole point of keeping mouth open. Otherwise we could do closed mouth. If closed mouth है तो sphenoid sinus we will not see. Got the point? Everything about this Waters view. This is the one which is done most routinely. Anytime you see opacification of maxillary sinus, if I am seeing as a margin, fluid level, this is suggestive of sinusitis. However, if you see ki margin as a upward, this is suggestive of a polyp, right? Not a CA, but a polyp. Carcinoma will never be so well defined. It will be very, very aggressive. It would destroy the bone, go out. So remember, always CA and invasive sinusitis. Remember two things. Invasive fungal sinusitis, which is IFS, and carcinoma of any maxillary sinus will always be very invasive, and the hallmark would be bony erosion or bony destruction, right? It would not follow the margins of the bones, right? So it would always erode, right? So it would not respect the bony margins, it would erode into the soft tissues. All right, so this is about this difference in general. Rhinitis is nasal, sinusitis is sinus, yes? Okay, what is this X-ray view that we are seeing when the face is seedha, right? Here the face was aise ulta. This is face seedha because now the forehead is in contact. Correct. So this has been asked in almost all of the exams in the last 1 year, whether it's FMG, NEET, INICT, they are just not leaving this. So this you can't afford to get wrong. Ye galat kiya to rank nahi aa raha. So this is Caldwell's view, and here the X-ray is passing from the occiput to the frontal, है ना? हाँ, एफएम सबका ही फेवरेट है ये. सो दिस इज, तो इसमें ट्रेंड ऐसा होता है हर एक क्वेश्चन का, that for 1 or 2 years it becomes INICT favorite. After that NEET picks it up and then FMG picks up. So this was INICT favorite 2 years back. Then it came in NEET for 2 years. Then it came in FMG since the last 2 years it's coming, right? So that is how the trend, goes. So this is Caldwell view, occipito frontal view, right? And this is the best obviously for the frontal sinuses. So frontal sinuses are going to be seen best here. ठीक है? Maxillary, how to identify it? So you won't be seeing the maxillary sinus. उसके ऊपर ना bone overlap कर जाएगा. So this is how you'll identify the Caldwell view. Okay? So is this clear to everybody? You are not making a mistake here. Apart from that, we have a few lesser known views. What is this? When we take it from the base, correct. So this is your basal view. All right, basal view is also called as submento vertex, SMV. So this is also called as submento vertex view. मतलब chin के नीचे से पीछे vertex पे जा रहा है. All right. The advantage here, I can see it as a cross section. Can you see? So ये पीछे वाले sphenoid sinus हो गए. These are your anterior, posterior ethmoid sinuses, and these are your maxillary sinus. Which sinus do I not see here? I'll tell you. Just hold on. सब बताऊंगी. Yes, this is the frontal sinus is not seen here, right? So here also I'm not seeing one sinus, which is frontal sinus. What is this view? This is just very easy lateral view, right? So lateral view, I can see the frontal sinus. I can see the ethmoidal sinus here. I can see the maxillary sinus. I can see the sphenoid sinus. So this is the sinus where I can actually visualize. This is the view where I can visualize all the sinuses. Yes, but the problem is there is overlap. Right and left will overlap, right? So we cannot distinguish कि right का problem है, left का है, but this is the only view. अगर पूछे कौन सा view है जिसमें all sinuses are seen, it's the lateral view. All right? Okay. What is this view? So the view where you actually actually see this foramen magnum. Foramen magnum जिसमें दिखेगा, remember, this is your Townes view. How to remember? तो foramen magnum is the center of your entire skull base, right? So remember, town के अंदर center होता है, right? So Townes view is foramen magnum, right? ठीक है? Okay. Who is SK? You are asking for PDF on the group. Okay, so Townes view, foramen magnum, right? So this is what we have here. What is this view where you are also seeing one implant? No, this is not Rees view. What is this view? This is the view where you are seeing cochlear implant. Yes, so here you want to remember the name of a young boy called Stenver. Stenver लड़का है जिसको cochlear implant लगा है. So this is the view that we use to see cochlear implant, to see the internal auditory canal. So this is where we have the internal auditory canal. All right, so this is Stenver's. And the next one is what you are seeing. So this is called as Law's view. modified Law's view, or this is also called as the Schuller's view. All right, so law or Schuller's view is when I want to see the mastoid air cells. Okay, so mastoid, no, I'll tell you. Mastoid air cells, can you see these air cells here? So this is the law or Schuller's view, and this is useful when we are dealing with mastoiditis. है ना? So when you see कि black है, pneumatized mastoid air cells है, then we don't have a problem. But when I see that these air cells are obliterated, we will actually look out for one angle. So here we will see that this angle actually compresses, and this angle is called as sinodural angle, which is also called as Sittel's angle. All right, Sittel's angle. So this is the sinodural angle that you're seeing, which is the Sittel's angle, and this is the law or Schuller's view. अब जो optic canal का पूछ रहे हो, what is that view called? That is the Rees view, है ना? That is the Rees view. फाइन. सो यहाँ पे मेस्टॉइड एयर सेल्स मिल रहे हैं, स्टेनवर्म में हमें मेस्टॉइड एयर सेल्स नहीं मिल रहे. वी आर लुकिंग एट द कॉक्लियर इम्प्लांट. ऑलराइट, सो इनके डिटेल्स में नहीं जाना. नोबडी इज गोना आस्क यू द पीएचडी इन दिस. दे आर जस्ट गोना आस्क यू कि व्यू का आइडेंटिफाई कर लो. ओके, सो दिस इज द एंगल, दिस इज साइनस एंड दिस इज द ड्यूरल प्लेट. सो दिस इज साइनोड्यूरल एंगल. इट विल बिकम acute if there is mastoiditis. Okay, बस इतना सा पता होना चाहिए. Sittel's abscess is different. What is Sittel's abscess? Is this the same? No, this is not Sittel's abscess. This is just a Sittel's angle. Abscess is completely different. Yes, so when we deal with mastoiditis, there are two main abscesses that you want to know. One is the Bezold abscess, and the other one is the Sittel's abscess. So Sittel's abscess will be along the digastric, whereas the Bezold abscess will be along the sternocleidomastoid, right? So you can just remember that here. Okay, बेजल में साइनसेस समझ नहीं आए, अभी सीटी देखेंगे तो समझ जाओगे. ठीक है, सो नाउ वी टॉक अबाउट पैरानेजल साइनस सीटी. दिस इज अगेन समथिंग जो बहुत बहुत फेवरेट क्वेश्चन है ऑफ योर एग्जामिनर्स, राइट? मेरा नहीं आया नहीं सीटी एग्जामिनर्स फेवरेट टॉपिक. ओके, राइट. सो व्हेनेवर वी आर टॉकिंग अबाउट पीएनएस इमेजिंग, व्हाट इज द इन्वेस्टिगेशन ऑफ चॉइस रेडियोलॉजिकली? HRCT. ठीक है, so high resolution CT is the radiological investigation of choice. Now let's talk about all the ethmoidal air cells. Those of you who've attended वो top 100 images, we have discussed this. So this will be like a quick revision. Okay, ethmoidal air cells सारे, which is the anterior most, A for आगे, है ना? आगे agar nasai, है ना? आगे का सेल agar nasai cell, which is the largest. नाम में ही है बड़ा सा, bulla ethmoidalis. This is the most constant ethmoidal air cell. सब में ही होगा. Remember, A and B are present in everyone. बाकी तीन are variants, not seen in everybody. A B सब में रहेगा. Infraorbital air cell is your Haller cell. This is an anatomical variant. If Haller cell is present, it can lead to obstruction of sinus. Optic nerve compression, O for optic nerve, O for Onodi cell. So when it is causing optic nerve, does it have to be anterior or posterior to cause optic nerve compression? इसको बहुत posterior रहना पड़ेगा. This is the posterior most ethmoidal air cell that you have. In fact, it reaches the sphenoid sinus. तो जिसको basal view समझ नहीं आया था, यहाँ पे पीछे हमारे पास sphenoid sinus है. These are your anterior ethmoid. This is your posterior ethmoid. So onodi is located here, इन दोनों के बीच में. Understanding? So this is where you have onodi, which is your posterior cell, and it can compress on the optic nerve. And what do you call a pneumatized middle terminate? Yeah, we call it a concha bullosa, right? So concha bullosa is your pneumatized middle turbinate. Fine. So these are all the names. Now they don't just ask you in one-liners, they ask you to identify. For that, we need to get the orientation of PNS. So always they will give you कंसेल से क्वेश्चन नहीं आया, नहीं, not important. Okay, so they'll give you a coronal CT image, right? And they will ask you the anatomy. So before we go into the air cells, a brief anatomy of the turbinates, right? So what is this turbinate जो attached है आपके bone से? So this is the inferior turbinate. And what is this bone arising from the inferior turbinate, which is going to form a part of the maxillary ostium? Yes, this is the uncinate process. So everybody with me, this is inferior turbinate and this is the uncinate process. Very nice. तो ये कौन सा turbinate होगा जो उसके ऊपर है? Obviously, this is the middle turbinate, and ये जो सबसे ऊपर के turbinate है, this is your superior turbinate. So overall anatomy समझ आ गई? This is maxillary sinus. यहाँ पे सारे cells दिख रहे हैं. These are your ethmoidal air cells. Okay? Anterior ethmoid पे है, posterior ethmoid पे है. So remember, anytime you see maxillary sinus in picture, We are quite anterior, right? We are not posterior. We are quite anterior when you see maxillary sinus. When you start to see sphenoid, when you start to see pterygoid plates, मतलब हम पीछे हैं. Here you can still see कि orbit में you are seeing the muscles and you are seeing the eye, right? So अभी हम फिर भी आगे ही है. We are not in the anterior most part, but we are still somewhere in the middle, है ना? Agar nasal will be सबसे anterior. So what are we doing? We are taking coronal cuts. आगे से पीछे. सबसे आगे जाएंगे, we'll see agar nasal. Somewhere in the between, I will see maxillary sinus becoming very big. More farther I go, I'll see maxillary sinus is over. I'll see pterygoid plates. I'll see sphenoid sinus. Understood? So this is the orientation, right? So we are somewhere in the middle. Na bahut aage, na bahut piche. All right. So now in this, let's go and talk about the occipital. Let's talk about the osteomeatal unit, OMU, which is the ostium here of the maxillary sinus. So first of all of you understand this is maxillary sinus and ये उसका ostium है where it is going to open up into the meatus, right? So first of all inferior turbinate से arise करता हुआ ये bone. What bone is this? This is your uncinate process. We always have to do an uncinectomy to do FES, functional endoscopic sinus surgery का step होता है कि ये तो निकालना ही पड़ेगा. Only then I can reach the ostium, right? So this bone I have to remove. Then the only constant cell that you have here forming a part of osteomeatal unit, largest air cell, bulla ethmoidalis. Correct? तो इतना समझ आ गया. Then we have this place, this space, which is your 2D space, which is called, very nice, this is called as infundibulum. And then it opens into this 3D space, which is called hiatus semilunaris. Correct? So this is hiatus semilunaris. So together, all of these form the osteomeatal unit. One more time, kya kya? Maxillary sinus ka ostium, the bone from inferior turbinate, which is your uncinate process. Then you have bulla ethmoidalis. दोनों के बीच में 2D infundibulum opens into a 3D space, which is hiatus semilunaris. So these are the components of osteomeatal unit. What else can you see here? Inferior turbinate, inferior turbinate. Look at both the middle turbinates. Yeah, so both the middle turbinates you see are all pneumatized. There is air here, right? So इनको क्या बोलेंगे? इनको बोलेंगे concha bullosa, CB. Concha bullosa, right? So we are also seeing concha bullosa here, which is a normal anatomical variant. It is the most common variant. अगर पूछे कि variant कौन सा most common है, it is actually concha bullosa. All right, so this is what we have. Hiatus semilunaris will not be attached to the roof. It will only be here SI. ठीक है? This is about that. Yes, there is some element of deviated nasal septum as well, right? You see this hook here, so this is DNS, right? Okay, now see this. पूरा पूरा आंख दिख रहा है. Can you see कि पूरा पूरा आंख दिख रहा है, globe दिख रहा है. So are we anterior, are we posterior? मैक्सिलरी साइनस अभी खुला भी नहीं, इतना छोटा सा लग रहा है. सो पूरी आंख दिख रही है. मैक्सिलरी साइनस इज स्मॉल, सो नाउ वी आर इन द एंटीरियर प्लेन. अंडरस्टैंडिंग? सो दिस इज द एंटीरियर व्यू, एंटीरियर कोरोनल कट लिया. सो नाउ ये वाले सेल कौन से होंगे जो सबसे आगे दिख रहे हैं? Correct. This will be agar nasal. So nobody has any doubt between agar nasal and bulla ethmoidalis. Both of them will be seen here, medial. ठीक है? So medial कौन है? आगे तो agar nasal and बीच में उससे थोड़ा सा पीछे तो bulla ethmoidalis. Now if I have infraorbital, not medial, but infraorbital, below the orbit, not medial. This is bulla. नीचे कौन सा है? Haller cell. So now understood, no confusion between Haller cell and bulla ethmoidalis. Yes. So Haller cell is below, whereas bulla is medial. Understood? So this is Haller cell and it can actually obstruct the osteomeatal unit and cause maxillary sinusitis or a mucocele of the maxillary sinus. So this can actually cause an obstruction. So is Haller's always present or is it a variant? Haller cell is a variant. It can be bigger also than bulla ethmoidalis because it is a variant, right? It is not always seen. Okay, so this is Haller cell, which is variant infraorbital. Now see this. Are we anterior or posterior, guys? देखो, maxillary sinus is गायब. I am seeing these are the pterygoid plates. This is medial and this is lateral pterygoid plate. This is body of pterygoid. This is sphenoid sinus. And you see sphenoid sinus के साथ there is one accessory cell. So ये कौन सा cell है which is as close as sphenoid sinus? So this is posterior most ethmoidal cell, which is your Onodi cell. And ON से ONOD, ON से यहीं पे run करती है our optic nerve. So if it grows, Can it block the optic nerve? Can it cause compression of optic nerve? Yes. So Onodi cell can lead to compression of optic nerve. Understood? So these are the three coronal planes. एकदम छोटू maxillary sinus, बड़ा बड़ा आँख, इंटीरियर मोस्ट, बुल्ला इथमोइडालिस ऑस्टियोमेटल यूनिट बीच में, बिल्कुल पीछे स्फिनॉइड एंड टेरिगोइड प्लेट्स, राइट? एंड व्हाट डू यू हैव हियर? So this was again a question that they asked. What they had done in the exam was they just basically put an arrow here and they had asked कि क्या ये क्या नीचे इथमोइड साइनस है, स्फिनोइड के नीचे, वो सब मत देखो, जो मैं दिखा रही हूँ जस्ट सी उतना, ऑलराइट? ऊपर नीचे हम नहीं देखेंगे, otherwise we'll never finish. Okay, what do we have here? So here they just asked whether this is anterior ethmoid or this is posterior ethmoidal canal. So this is actually your anterior ethmoidal canal. So ultimately you have to rule out the option and just find out ki, okay, we are still anterior because maxillary sinus puri puri dikh rahi hai. This is not posterior ethmoidal. Okay, so this is what we have. So here middle turbinate is not really abnormal, but do you see how their curvature is ulta? Yes. So when we find that middle turbinate has a curvature which is opposite, this is called as paradoxical middle turbinate. All right, not very important, but this is called as paradoxical middle turbinate. So there are so many variants in PNS anatomy. If you go on into understanding each one of them, we'll never be able to finish other topics of ENT, and we don't want to do that. जो पूछा है अभी तक उतना ही हम करेंगे, right? Now let's talk about the drainage. Now let's talk about the drainage of sinus. I'm sure you guys know that. What drains into the inferior meatus? It is the nasolacrimal duct. What drains into the middle meatus? Three things. So let's see for ourselves. So now I'm showing you a sagittal representation, isn't it? So I can see ऊपर से frontal sinus is coming, anterior ethmoidal is draining here, and यहाँ से maxillary sinus is draining here. So we have three things. What do we remember? We remember frame. So I have the frontal sinus, I have the maxillary sinus, and I have the anterior ethmoidal sinus, all of which are draining in the middle meatus. Correct? On the other hand, look here. Can you see this green bony line? What is this green bony line called, which is actually attached here? This is the basal lamella. ये middle turbinate है और उसका जो lamella है, this is basal lamella, which separates anterior ethmoid from posterior ethmoid. Okay, so remember, basal lamella of middle turbinate is what separates anterior from posterior. And can you see how posterior ethmoidal is draining where? It is draining in the superior meatus, right? So it's draining in the superior meatus. And पीछे वाला sphenoid sinus will drain where? Sphenoethmoidal recess. Sphenoethmoidal recess. ठीक है, तो एक क्विज ले लूं फटाफट. फर्स्ट ऑफ ऑल आइडेंटिफाई इन्वेस्टिगेशन. सीटी है या एमआरआई है? Bones are white, air is black. This is CT. Which view? Sagittal coronal. Sagittal liya hai, right? So what is this sinus? This is the frontal sinus. All right. What is this? This is the middle turbinate. And can you see actually यहाँ पे concha bullosa है because there is air within the middle turbinate. Yeah. All right. So now look at this. Frontal sinus is draining here. Maxillary sinus is draining here, and anterior ethmoidal are draining here. So this is your middle meatus. Correct? Then look at this. What is this bone called, which is attached to the middle turbinate, which separates anterior ethmoid and posterior ethmoid? This is the basal lamella, not uncinate process. This is basal lamella. Uncinate process will be attached to inferior turbinate. Correct? Okay. So this posterior ethmoid is draining here, superior meatus. And then we have the sphenoid sinus, which is draining here in the sphenoethmoidal recess. So this is the sphenoid sinus. And can you see this? What is this? This is the house of pituitary, sella turcica. Sella turcica का literal meaning क्या होता है? This was asked in the AIMS exam which I gave. It means Turkish saddle. है ना? तो जो horse पे बैठते हैं टर्की में उसको बोलते हैं sella turcica. This look like that, horse seat. Yes. So this is Turkish saddle. Okay. All right. And one more thing. Yeah. What else can we make into middle meatus? So remember, do you know DCR? DCR कहते हैं dacrocystorhinostomy. So DCR is also, the opening of DCR is also made into middle meatus. So remember that. When in doubt, mark middle meatus. Okay. So dacrocystorhinostomy is for middle meatus. इसमें नहीं दिख रहा because this is a sagittal cut, no? So नीचे होगा. Right. So this is that. Now, one more thing, which is the Kiros classification. So this is for determining the depth of skull base. Skull base ka again anatomy is a bit complex, but once you understand, you will never forget, right? तो मैंने इतनी बार पढ़ा दिया है. Those of you are older students, ये वाला क्या है? ये है क्रिस्टा गैलाई. क्रिस्टा गैलाई के साथ में जो plates हैं, what do we call them? We call them cribriform plate. The cribriform plate का जो margin है, ऊपर है, what are these called? We did basal lamella. ये कौन सा lamella हो गया? Lateral lamella. So this is lateral lamella, and then I have the roof. The roof is called as fovea ethmoidalis. So this is called as fovea ethmoidalis. All right, did you understand? So what do we have? Let me show it to you in this image also. So here I have crista galli, cribriform plate, lateral labella, and then the horizontal roof is fovea ethmoidalis. Got it? So now I want to see the depth of the cribriform plate. From the fovea, how deep is the cribriform plate? 1 to 3 mm, 1, 4 to 7, 2, 8 to 16, 3. Do you want to remember that? No. Which is most common? In most population, it is 2. But अगर बहुत deep है, if you have Kiros type 3, it can lead to an increased risk of CSF leak after FES. So we are doing functional endoscopic sinus surgery. In people who have very deep skull base, which is Kiros type 3, they can have a higher risk of CSF leak after FES. And that is the importance of knowing about Kiros. So नाम याद रखो, skull base and type 3 is bad, type 2 is most common. बाकी ये anatomy समझ गए. All right, यहीं पे याद रख लो. Most common site of CSF rhinorrhea is what? Cribriform plate. Most common site of traumatic CSF rhinorrhea is what? It is fovea ethmoidalis, right? So trauma में यहाँ होगा, normal में CP. ठीक है, तो ये करना है. Yes, so before doing FES, always a CTPNS is done. Okay, so ये CTPNS करते हैं, उसमें हम उनको सारी चीज बताते हैं. We'll tell them what are the variants, how is the anatomy, what is the Kiros, so that you know they know what they are dealing with. Okay. Right. Now let's quickly talk about sinusitis. Like we saw, sinusitis will have some sort of opacification. In addition, what do you see here? Repeat question. What do you see here? This is the superior turbinate which has air. So this is also your INI-CT question. Now we are dealing with a case of pneumatized superior turbinate. It does not have any name. इसको मामूली pneumatized ST बोलेंगे. Right? In addition, you are seeing sinusitis. So a few one-liners of sinusitis. Investigation of choice. Same, HRCT. What is the gold standard if I ask you? Something that can treat also, like we are seeing FES, right? So endoscopy or FES, functional endoscopic sinus surgery, or just endoscopy basically is your gold standard. Yeah, this is right, this is left, okay? Okay, right. What is the most common sinusitis in adults? Maxillary sinusitis. In children, ethmoid, right? So baby questions you all know. What is the most common sinus to be complicated by mucosal? To be complicated by osteomyelitis, to be complicated by fistula. I make it simple. सबका आंसर सेम है, frontal, right? So frontal sinus में mucosal बनेगा when it's obstructed. Osteomyelitis जब बनेगा, what do we call that? When there is osteomyelitis and there is a subperiosteal abscess, we call it Pott's puffy tumor. So ये patient आएगा डर के कि डॉक्टर साहब मुझे ट्यूमर हो गया है सर पे, I am having this massive swelling. When you do a CT or MRI, you will see that there is pus, there is ring enhancing. Do you see this? There is enhancement in the periphery. Anytime you find a lesion which is ring enhancing, that means that you are dealing with an abscess, right? क्योंकि अंदर पानी है, बाहर wall है, wall will enhance. So this is ring enhancing Pott's puffy tumor. So this is actually a subperiosteal abscess, which is a complication of frontal sinusitis, right? And this is called as Pott's puffy tumor. Will you make this diagnosis, guys? Even if they give you CT, MRI, will you make this diagnosis? Ring enhancing lesion. This is not a true tumor, correct? Okay. Fistula भी यही बनेगा. Most common orbital complication अगर है, which is the sinusitis which is responsible for that, closest, right? So closest to it, ethmoid. So ethmoid sinusitis can lead to orbital complications most commonly. Okay, so these are all the possible questions on sinusitis. Okay. Now going on to trauma, right? Why are we going into trauma? Just for, anyways, what do you see here? Can you see how there's an arrow here and you are seeing that there's a fracture here? Yes, so this is actually showing you a skull base fracture which can lead to CSF rhinorrhea. Can you identify the site for me? What is the site which is involved here? Is it cribriform plate? Is it lateral lamella? Is it fovea ethmoidalis? Good. It is fovea ethmoidalis. Means you've understood, right? So ये cristagella है, यहाँ पे cribriform plate, फिर lateral lamella, and this is fovea. Okay, so this is fovea ethmoidalis, which is the most common cause in trauma. Okay, right. What about this? When you see opacification of bilateral ethmoid sinusitis, bilateral ethmoid air cells. What are, so these are both polyps. So now you have to identify the type of polyp for me. When you see bilateral, this is abhi aayenge CSF leak pe, just wait. This is ethmoidal polyp, right? So ethmoidal polyp के बारे में कुछ चीजें बताओ. Is it more commonly unilateral or bilateral? It's more commonly bilateral. Does it have good prognosis, bad prognosis? As in, does it recur? Yes, it recurs more commonly, right? So this is something which is going to recur more frequently. It is more bilateral, and it's associated with what? It is associated with Samter's triad. It is normal. It is just a normal variant, pneumatized turbinate. Samter's triad क्या है बताओ बच्चों? Yes, there is aspirin hypersensitivity, there is bilateral ethmoidal polyps, and then it's associated with atopy or asthma. All right, so this can be asked. On the other hand, when you find a polyp which is going in one sinus and then it is going into the choana, so this is your antrochoanal polyp, right? So this will be a very well defined lobulated sort of a lesion which is going on one side. So this is always going to be unilateral. If we resect it out, this does not recur, right? So this has a good outcome to the surgery. Okay, so this is about the two different polyps. Now in the history, next case, very important for exams. For INICT, favorite question. One new point. Have you heard this? Here the patient will come to you with discharge. It looks like peanut butter. It is so yucky point. Right? So peanut butter type ka discharge leke patient aayega. And when you look at the CT, you will see this double density. So two buzzwords for you. Peanut butter. Second buzzword, you see a double density sign on CT. Remember, all of you are mixing this up with papilloma. So see, जब CT दिया and double density sign मिले, मतलब black and then white on CT, which is your hyphae. These are your fungal hyphae. So this is what? This is allergic fungal sinusitis, AFS, right? So whenever you see double density, very important image based question, allergic fungal sinusitis. What is the criteria asked in last INICT? This is something we had done in one of the midnight expresses. This is Bent and Kunz criteria. So do you need to memorize this? Not really. Let's just go through it. So major features क्या है वो पता होना चाहिए. So type 1 hypersensitivity, नाम से पता लग रहा है. Nasal polyposis, characteristic CT finding, double density. So you need to know. Eosinophilic mucin without invasion, positive fungal stain. इसमें ये ऑप्शन देंगे फंगल कल्चर. सो रिमेंबर फंगल कल्चर इज अ माइनर फीचर, राइट? इट इज नॉट अ मेजर फीचर. ऑलराइट, सो दिस इज अबाउट एलर्जिक फंगल साइनोसाइटिस. विल यू रिमेंबर डबल डेंसिटी ऑन सीटी? इसीलिए मैंने साथ में रखा ये. दिस इज सीटी और एमआर. फर्स्ट ऑफ ऑल MRI, right? So you can see how the bones are black and you see the brain very nice. So this is MRI. जब MRI में similar looking lesion, but you are seeing that it is having white and black areas, right? So yes, this is a T2 weighted MR. Water is white, all the CSF is white, है ना? आँख भी white है. There's a T2 weighted MR. You are seeing a T2 hyper intense lesion with a very cerebriform appearance. Can you see कि यहाँ पे lines, and when you see the endoscopy, you are seeing again this brain-like appearance, isn't it? So this is called as the cerebriform appearance. Have we done so many cerebriform appearances already? Derma में कहाँ पढ़ा था बताओ, याद करो. Now it will be so much fun if we are going to be together for 6 months. ना हम बार बार रिवाइज करते रहेंगे and we will keep remembering whatever we have done, है ना? तो सिजारी में हमने देखा था कि cerebriform nucleus है, right? So that was cutaneous T cell lymphoma, mycosis fungoides. One more point which we had read with that, वो क्या था? There is epidermotropism, है ना? याद है कि cells are coming to the epidermis. And the other thing, what kind of microabscesses? Potter's microabscesses, right? So lymphocytic microabscesses here. ठीक है, और कुछ भी बोलने वाली थी. हाँ, cerebriform appearance of stomach is seen in, one of you had mentioned it, menetriers, correct? So menetriers as well as gastrinoma, perfect. You will see a stomach with a cerebriform appearance. ठीक है, चलो. So this is about cerebriform appearance. This is inverted papilloma. This is also called as what? This is also called as the Ringer's tumor. एंड दिस इज समथिंग विच इज सीन इन एल्डरली मेल पेशेंट्स, है ना. तो देख के लगेगा कि मैक्सिलरी साइनस सीए भी हो सकता है, बट दिस विल नॉट इन्वेड द बोन. दिस विल हैव दिस टिपिकल सेरिब्रिफॉर्म appearance, and the origin is what you are saying, so it arises from the Schneiderian membrane. All right, so this is your Schneiderian membrane where it arises from. Treat कैसे करेंगे? Surgery is the treatment of choice. This is the incision that we give. Very nice. So this is the Moore's incision. This is the Moore's incision that we give. This is not Weber Ferguson, right? This can bleed. Okay, so this is the Moore's incision for lateral rhinotomy. Can you see कि नाक के side में है? So this can be lateral rhinotomy or what? Medial maxillectomy. So lateral rhinotomy बोल लो या medial maxillectomy बोल लो, दोनों के लिए we use this Moore's incision. How to not confuse it with Weber Ferguson? This will stop here, whereas Weber Ferguson will go here. It is your lip splitting incision, right? So everybody understood inverted papilloma का diagnosis? Yeah. On the other hand, membrane कहाँ पे है? वो नाक में है, वो दिखे ही नहीं किसी को, right? वो origin है. Okay, right. On the other hand, when you see this, now look at this mass. Again, an old patient came to you with nasal obstruction, epistaxis, and you see कि अब ये बाहर जा रहा है. Do you see how the bone is eroded and it's reaching up to the skin? So ये कौन है? This is malignancy, right? So this is how malignancy will appear. So this is maxillary sinus carcinoma. This can be squamous cell. This can be adenosine. दो buzzwords. अगर wood industry है तो कौन सा सी ज्यादा कॉमन होता है? इन वुड इट इज एडेनोसीए. सो वुड में ज्यादा एडेनो, वुड में दो ओ है, so it starts with vowel. Okay, more vowels stick together. On the other hand, nickel industry में we will have more commonly squamous, है ना. तो ये आपको हिस्ट्री के buzzwords दे सकते हैं. Okay, so this is about nickel industry, squamous cell CA. इसको ट्रीट करने के लिए हम ये इंसिजन देते हैं विच इज कॉल्ड एज वेबर फर्ग्यूसन. सो वेबर फर्ग्यूसन इज योर लिप स्प्लिटिंग, पूरा पूरा आएगा, एंड दिस इज एन इंसिजन विच इज गिवन फॉर टोटल मैक्सिलेक्टमी. ठीक है, पूरा पूरा मैक्सिला हटाना है. व्हाट इज दिस लाइन? इज दिस सर्जिकल इंसिजन और इज दिस प्रोग्नोस्टिकेटिंग लाइन? So line from medial canthus to angle of mandible, this is your Ongren's line. Ongren's line, remember, is for prognosis. कि अगर maxillary sinus CA इसके मीडियल है तो वेरी गुड, बट अगर वो आंख तक चला गया, ऊपर चला गया, इज दैट गुड? No, that is always bad, right? तो अंदर तक है तब तक it's okay, but when it goes outside above that line, that is bad prognosis. Okay, so this is your Ongren's line. Okay, one more incision since we are doing all the incisions. If you have Gluck Sorensen incision नीचे तक जा रहा है, this is an incision for total laryngectomy. तो यहाँ पे आपका कैसा क्वेश्चन बनता है INICT का? They'll give you 4 lines and they'll ask you match the following. Correct? So कर लोगे match the following? Moores for inverted papilloma, Weber Ferguson for total maxillectomy, Gluck Sorensen for total laryngectomy. We'll get to that. Just hold on, है ना. अगर मैं ना पढ़ाऊँ एंड में तो मुझे पूछो. Okay. What is this? One more classification. This is Lederman's classification. Lederman's classification is just anatomical classification. Okay, so because we're doing all the names, I've just clubbed them together. तो यहाँ पे दो lines है, Sibilu की lines है ये दो. All right. उससे हमने basically divide कर दिया. So what you need to know is these are your suprastructure. This is meso and this is infra. If I was your examiner, I would just ask you कि meso में क्या है. So meso has M for maxillary and nose कौन सा? रेस्पिरेटरी पार्ट ऑफ नोज. बाकी सारी चीजें कहाँ है? बाकी सारी चीजें इज इन सुप्रास्ट्रक्चर. इंफ्रा में क्या है? दांत. सो जस्ट रिमेंबर कि मीजो में क्या है एंड एवरीथिंग एल्स इज गोना बी इन सुप्रास्ट्रक्चर, राइट? सो कैन यू रिमेंबर दिस आल्सो? वेरी वेरी इजी. तो ये है लेडरमैन. ओके, no you interrupt, but just don't ask for new things. matlab I will already teach you things, right, which I think are important. Okay, so this is Hammer and Radberg classification. So this is the classification for the pneumatization of sphenoid. ये सब सुना हुआ है आप लोगों ने. So this is for sphenoid pneumatization. I have also not heard them, but who would have heard them? But just see, खाली एक बार नाम पढ़ लो, so that in case they give you all match the following. So I've kept all the names together so that you can just review them once. इसको छोटी कॉपी में मत डालना, not worth it. Okay, so just see it once when you see the PDF. All of these classes, guys, make sure you are revising the PDF. Okay, वो नहीं ये previous year नहीं है. These are all potential things which I've also included based on previous year question. ठीक है, खाली PYQs थोड़ी करेंगे, दोस्त जो भी प्रीवियस ईयर क्वेश्चन आया है यू हैव टू बेसिकली सी कि अब क्या आ सकता है. फाइन, तो आप लोग कुछ मत करो, you study what I am teaching. Okay, so this is hammer and Radberg. So this is sphenoid pneumatization. So there are three types. जब baby थोड़ा सा ही हुआ, this is concal. Pre-cellar, where it is reaching before cellar, and when it is below the cellar it is cellar. तो most common in babies क्या है, छोटू छोटू बेबी, छोटू छोटू कॉन्का. So this is your most common in babies or basically children, right? So C for children, C for conker. On the other hand, अगर मैं पूछूं most common in adults क्या है, it is cellar. Okay, so this is what we have here. इसका importance क्या है, क्यों हम ये सब पढ़ रहे हैं? इसका importance comes in, have you heard of pituitary surgery which happens via sphenoidal sinus? Transnasal transphenoidal pituitary surgery, TNTS बोलते हैं, right? So transnasal transphenoidal. So do you agree that अगर sphenoid sinus pneumatized ही नहीं है, then it will be very difficult क्योंकि उनको bone drill करके जाना पड़ेगा. So that is why before doing pituitary surgery for adenoma or any pituitary tumor, most commonly adenoma only, we need to know the sinus का pneumatization status. तो इसके लिए भी हम CT करके पहले देखते हैं कि what is the sinus status. Okay, so that is the importance. Most important question, you can't go wrong here. The moment you hear male adolescent with epistaxis, only one diagnosis. Adolescent को खून निकला मतलब उसको JNA है. Juvenile nasal angiofibroma. The name has angiofibroma. No muscle. So what happens? Angiofibroma, vessels are proliferating. So this is going to bleed, right? So agar मैं इसको biopsy करूंगी, what will happen? It will bleed torrentially, right? There is no muscle to tamponade it. So that is why biopsy is contraindicated. So how do I diagnose it? What is the investigation of choice? Radiology, right? So CCT is your investigation of choice here. Very good. Clinically कैसा appearance मिलेगा? Because there is nasal obstruction and there is swelling, this is called as frog face. Correct. CT में क्या दिखेगा? CT में you will see an enhancing mass. So you are seeing that there is a mass here. Where does it originate? It originates from the sphenopalatine fossa, SPF. SPF is where it originates, sphenopalatine, behind the sphenoid sinus, and then it grows laterally. So what is the growth called? So medial to lateral. आज फिर से black आ गया for some reason. So let's say this is the sphenoid sinus. It is going to start here behind the sphenoid sinus, which is called as the sphenopalatine foramina. All right. Now it will grow laterally. हर्ष मुझे DM करो, I will add you. ठीक है. Sphenopalatine, क्योंकि अभी एंड में भेजूंगी लिंक, रिमाइंड मी. Sphenopalatine foramen. अब वो laterally जा रहा है. So यहाँ पे आगे क्या है आपके पास? Maxillary sinus. So now when it grows laterally, it is going to grow into the PPF. PPF का नाम क्या है? Pterygopalatine fossa. Pterygopalatine fossa. And through the pterygopalatine fossa, it will grow laterally into ITF. ITF क्या है? Infratemporal fossa. So do you agree that it's growing behind the maxillary sinus? Sphenopalatine foramen, ये जो बीच में है, do you see this छोटा सा bone, pterygoid bone? ये वाला pterygopalatine fossa है. And then it grows into infratemporal fossa. Yes, there's a pterygomaxillary fissure also here. Just before sphenopalatine and this, there is a pterygomaxillary fissure. Not very, very important. Okay, so these are the 3 points at which the tumor is growing. And can you see this white tumor which is pushing the maxillary sinus anteriorly? Yeah, this is CCT. Because you're seeing the mass is white, right? Why we are giving contrast? Because it's a vascular tumor. Got it? So ये maxillary sinus को पीछे से आगे push कर रहा है. So this bowing of the posterior wall of maxillary sinus is called as Hohmann-Miller sign. How many of you are FMG aspirants here? This was your last year ka question, okay, multiple times asked. This is a Hohmann-Miller sign which is seen in JNA. Now there is a classification. For those of you who are attempting INICT, this is the classification which is Radkowski staging. Radkowski staging mein you need to know something in detail. One is what? Only in the nose and paranasal sinus. Very easy. Naak tak hi hai. 2A, 2B, 2C is important. So 2A mein kya hua? The first thing that we learnt, sphenopalatine foramen mein gaya. 2B was what? The second big name we learnt, pterygopalatine. Third mein kaha gaya? Third name we learnt, infratemporal fossa. Now it's making sense. Sphenopalatine, pterygopalatine, and then infratemporal. So can I say that the moment I see Hohmann-Miller sign, it is already 2C? Can I make that generalization? Yeah, है ना, क्योंकि यहाँ तक ही आएगा PPF तो. The moment it causes Hohmann Miller means it is already in infratemporal fossa. So it's 2C. Got it? 3 is when you have, what about 2B? So Rakshit, 2B will only be here ना. Pterygopalatine fossa is just इतना. पूरा अगर bowing हो रहा है means it is in infratemporal. All of this is infratemporal fossa. Got it? 3 is intracranial extension. So minimal है तो 3 है, extensive है तो 3B. Not very important. Got it? So we have learned everything about JNA. How do you manage JNA? Treatment of choice, surgery, right? But is this a vascular tumor? Yes, this bleeds a lot in surgery, right? So before surgery, do we have to do something? Yes, so we do a pre-operative DSA, which is digital subtraction angiography and embolization. So I am going to do a DSA wherein I enter maxillary artery. कौन से vessel में जा रहे हैं? This is your internal maxillary artery where I will go and I will embolize it. I will put glue here and I will block these vessels. इसको बोलते हैं embolization. So this is a DSA run. ये वाला vessel is your internal carotid artery. ये वाला है external carotid. So two branches I want you to know. जो सबसे नीचे है, what is this branch? LA, lingual artery. What is this branch? This is facial artery. And what is this branch जो सबसे ऊपर की terminal division है? This is internal maxillary artery. And what supplies the JNA? So JNA को maximum supply मिलता है through internal maxillary artery. तो हम IMA को पूरी embolize कर देते हैं and then the person is taken up for surgery. If the tumor is unresectable, अगर unresectable tumor है, then what do we want to do? You can give radiotherapy also. Apart from that, is there any drug that we can give? Why is this occurring only in males? Only occurring in males because it is testosterone dependent, right? So I can actually give flutamide here, right? So I can give flutamide here. Okay. Complication नहीं होगा. Complication तो हर चीज से हो सकता है, but here we are blocking the tumor feeder, right? So complication कुछ नहीं होता. Okay, because we are not blocking the main artery. ये नहीं कि यहीं पे खत्म कर दी. We are going distally and we are seeing what are the vessels which are supplying the tumor. उसको खत्म करेंगे. Okay. What is this? This is sign which is called as, very nice, Dodd sign. So Dodd sign is used to distinguish a juvenile nasal angiofibroma from an antrochoanal polyp. Thank you so much for commenting on my handwriting. Okay, so this is the, what is this? Whenever you see that there is a rim of, there's a crescent of air around this mass, this means that it's not arising from nasopharynx, right? Juvenile nasopharyngeal angiofibroma should not have air here. So the fact that there's air means that this is a polyp, this is an antrochoanal polyp. So Dodd sign is used to distinguish them. Got it? Okay, what is this? So when you see elderly patient है with this skull based tumor, now see कि पूरा नाक में है, and then where is it going? It's going ऊपर, anterior skull base को involve कर रहा है, right? So this is esthesioneuroblastoma. Can this be nasopharyngeal CSO? Anteriorly आंखें दिख रही है, maxillary sinus दिख रहा है? No. So we are into anterior skull base. So this is esthesioneuroblastoma. Can this be maxillary sinus cancer? वो भी हो सकता है मैक्सिलरी साइनस सी है. डॉड साइन में ना यहाँ पे एयर दिख जाएगी. कैन यू सी कि ये मास के हर जगह पे एयर है. सो दैट मींस इट्स अ पॉलिप, इट्स नॉट अ जेएनए. ठीक है अभिजीत? ओके, सो एल्डरली पेशेंट एंड दिस इज सेरेब्रिफॉर्म की तरह दिख रहा है. नो नो, दिस इज कॉन्ट्रास्ट. नो, दिस इज नॉट इवन T1, दिस इज कॉन्ट्रास्ट एनहांस लीजन. सो दे विल नॉट आस्क यू टू डायग्नोज दिस, डोंट वरी. रेडियोलॉजी पे डायग्नोज करने को बहुत मुश्किल से बोलेंगे, बट दिस इज नॉट इन्वर्टेड पैपिलोमा. वो तो खाली मैक्सिलरी साइनस. कैन इट इन्वेड एंड गो इनटू ब्रेन लाइक दिस? Inverted papilloma? Never, है ना? It will never go ऊपर. So this is a very aggressive mass. क्या ये maxillary sinus CA हो सकता है? वो बिल्कुल हो सकता है. But can it be inverted papilloma? No. ठीक है. So this is esthesioneuroblastoma. कहाँ से arise करता है esthesioneuroblastoma? It arises from the olfactory epithelium, right? So olfactory epithelium से arise करेगा. It tends to involve the anterior skull base through the cribriform plate. वही बता रही हूँ. It can go into cribriform plate. The other question that can come here, what is the classification that we see? Hondusa sign not important. What is the classification that you can see for esthesioneuroblastoma? It's called as the Kaddish classification, right? So we use the Kaddish classification for esthesioneuroblastoma. Anterior skull base. It can involve anterior skull base. Okay. And remember, it can, yes, this is MRI. This is MRI. Bones are black. Yes, I need to take radio for you guys. आज रेडियो की क्लास है रात को, मिडनाइट एक्सप्रेस टाइम 11 o'clock. Okay, esthesioneuroblastoma, remember what was I saying? Yeah, it can cause cervical metastasis. All right, cervical lymph node में metastasis दे सकता है. So these are the points that you want to remember, which can be asked for ENB. They will not ask you this वैसे. Okay, right. ये सब हाँ मतलब अब पढ़ा पढ़ा के मुझे याद हो गई कुछ कुछ चीजें. सम थिंग्स आई एम लर्निंग न्यू एंड आई एम क्यूमुलेटिवली लर्निंग. ओके, so this diabetic patient, ये तो बता ही दोगे कोविड के बाद तो nobody is getting it wrong. Mucormycosis. So without the history of diabetic or COVID-19 or immunocompromised patient, do not make this diagnosis. Mucormycosis, good fungus to have, bad fungus to have? Not a good fungus to have, right? Because it will cause everything black. Why? Because it is angio-invasive, right? It is angio-invasive. सब कुछ necrosis कर देगा. It will invade into stuff. It will cause necrosis of everything. So KOH mount या फिर माइक्रो में क्या मिलेगा? कैसे हाइफे मिलेंगे? सेप्टेट और एसेप्टेट. एस्परजिलोसिस से डिस्टिंग्विश करना है, राइट? एसेप्टेट. सेकेंडली acute angle, obtuse angle, obtuse angle, right? So obtuse angle aseptate. Aspergillus is going to be septate. Aspergillus के नाम में आता है कि वो septate है. ठीक है, ए इग्नोर करना है. It is not aseptate, it is septate. Okay, so this is going to be ribbon shaped, broad shaped, aseptate, obtuse angle, hyphae. MRI पे क्या दिखेगा? This is also contrast enhanced MRI, right? Wherein you are seeing कि बाकी सब तो white enhance हो रहा है, but you are seeing one turbinate here is not enhancing only. Why? Because angio invasion से necrosis हो गया. So this is called as black turbinate sign. Clinically क्या दिखेगा? You all know this black fungus, इसीलिए इसका नाम पड़ गया, although it is not a black fungus, right? What was the black fungus we have studied in dermat, जिसको Tinea nigra बोलते हैं? No, what are you all saying? No, Malassezia. Yes, finally, it is the Axiophila wernicki, right? Axiophila wernicki. Malassezia furfur was what? ये सब नहीं करना. Tinea versicolor. If you get stuff wrong from what I have taught, no, then it is not good. Okay, so even if you don't study anything, at least revise this again and again, because this is accumulated in one place and you cannot get stuff wrong from this. That is a promise that you are making me कि दुनिया भर की चीजें पढ़ोगे but सेम चीजें गलत कर दी जो मैंने पढ़ाई, then it's not a good thing. Okay, इतने मनी भी दिए, इतना टाइम भी दिया, मेरा भी टाइम वेस्ट हुआ, ऐसा नहीं करना. Okay, so this is mucormycosis. All right, then next thing, 52. So keep revising same thing again and again. That is the most important thing. Don't go after everything कि marrow भी कर लेंगे, prepladder भी कर लेंगे, cerebellum भी कर देंगे, neuros भी कर देंगे. No, just do one thing and do it again and again and make sure उसमें से गलत ना हो. Then keep adding stuff धीरे धीरे कि चलो इतना तो हो ही गया, now I will go and find other things. पता चले सब लेने गए और सभी छूट गया. Don't do that. Okay? हाँ, सिर्फ मेरा करेंगे वो भी ठीक है, but उतना तो करके फिर कहीं और जाना है. Okay? 52-year-old with conductive hearing loss. क्या? चलो चलो बातें बाद में. सो बताओ क्या डायग्नोसिस है? 3 इमेज बेस्ड क्वेश्चंस. ये डायग्नोसिस बताओ. ईयर के ऐसा टिम्पैनिक मेम्ब्रेन दिखेगा ब्लूइश ह्यू. दिस इज कॉल्ड एज ग्लू ईयर, है ना? तो पानी से भरा हुआ ग्लू ईयर विच इज योर सीरस ओटाइटिस मीडिया. तो जब ओल्ड पेशेंट में सीरस ओटाइटिस मीडिया मिलता है एंड यू हैव कंडक्टिव हियरिंग लॉस, ऑलवेज थिंक ऑफ नेजोफैरिंजियल कार्सिनोमा. वेरी वेरी इंपॉर्टेंट, मस्ट नो क्वेश्चन. ट्रोटोस्टाइड में क्या आता है? एनपीसी से याद रखना है. एन फॉर neuralgia, along which nerve? Fifth nerve. P for palatal palsy. Why palatal palsy? क्योंकि 10th cranial nerve involve हो गई. 10th cranial nerve. C से क्या? C से देख लिया, conductive hearing loss. So this is the Trotter's triad of NPCA. However, ये देखो कहाँ जाके उग रहा है. This is the nasopharynx where it's growing. Can you see that? So it arises from where? It arises from fossa of Rosenmuller. क्या आपने कभी किसी का fossa of Rosenmuller देखा है? मैंने भी नहीं देखा. सो ऑब्वियसली पेशेंट विल नॉट टेल यू ना कि डॉक्टर साहब मेरे फॉसा ऑफ रोजनम्यूलर में ट्यूमर है. The patient will come very late when you know he has cervical metastasis. So that is why the most common presentation is cervical lymph node, right? So that is why it presents late, and that is why treatment क्या है? Usually we can't do surgery here, so it's CTRT, chemo radio करके treat करेंगे, because it's always surgical resection. Okay. हाँ, वो हो सकता है, बट स्टिल पता ही नहीं चलेगा आपके भी फॉसा ऑफ रोजनम्यूलर, यू नो एवरीथिंग अबाउट फॉसा रोजन, स्टिल यू वोंट नो ना कि वहां पे ट्यूमर है. पाल्सी इज यूनिलैटरल या यूनिलैटरल, बिकॉज वेरेवर साइड इज ट्यूमर. ओके, वैसा करके. ठीक है. ऑन द अदर हैंड अगर ग्लू ईयर मिलता है, सो ग्लू ईयर का पैटर्न समझो. ग्लू ईयर अडल्ट में मिला, नेजोफैरिंजियल सीए. ग्लू ईयर बच्चे में मिला, वेर यू हैव दिस नेजोफैरिंग्स पे ही मास है. So this is because of adenoid hypertrophy. So are you understanding कि glue ear कैसे हुआ? Glue ear हुआ when you have eustachian tube obstruction, isn't it? So see this. Fossa of Rosenmuller के पास क्या है? We have torus tubaris, right? So torus tubaris क्या करता है? यहीं पे ट्यूब खुलता है. So because the tube is getting obstructed by any mass here, the mass could be nasopharyngeal CA, the mass could be adenoids, right? So anytime it gets obstructed, you will have glue ear. Got it? So ये दोनों चीजें याद रखोगे, बच्चा versus adult. Okay. On the other hand, look at this very tiny little mass here. So this is your T1 weighted image where you're seeing this mucin filled hyperintense cyst. I am saying you that there is a small nasopharyngeal cyst. Anybody can tell me the diagnosis here? Be very happy. Good. So this is Thornwald cyst, right? So this is your Thornwald cyst, which is actually a remnant of notochord. Notochord ने थोड़ा सा remnant छोड़ दिया, which is the Rathke's pouch, जहाँ से ये Thornwald cyst उगेगा. So see nasopharynx के 3 DDs. बच्चा दिखा, adenoid, elderly, NPCA, very very small, well-defined lesion, Thornwald cyst. Okay, will you remember these 3 nasopharyngeal masses? Okay. तो हमने करा कौन सा ट्रायड? Trotter's triad. The second triad we want to do, remnant of notochord. Notochord होता है ना सेंटर में जो चला जाता है बाद में. Gradenigo syndrome. Gradenigo syndrome is for petrositis. So do you know the petrous bone of petrous part of temporal bone? This is the petrous part of temporal bone here. That becomes inflamed. So this is petrositis. What is the triad? Yes, very nice. So one, you will have retroorbital pain. Why? Because of fifth nerve, same as trotters. The other thing, you will have sixth nerve palsy here. So sixth nerve गया तो क्या हो जाएगा? Diplopia हो जाएगा. And what is the third thing that you will have here? Because there is CSOM का complication है, you also have ear discharge. Alright, so ये बस concept से याद रखो, 5-6 और ear discharge. So this is your Gradenigo's syndrome. वन मोर सिंड्रोम, क्योंकि ग्रैडनिगो है तो साथ से कंफ्यूज नहीं करना, ग्रिसल सिंड्रोम. सो ग्रिसल इज atlantoaxial dislocation which can occur when it can occur secondary to this position. What is this position? This is Rowe's position of tonsillectomy. Very nice. जहाँ पे हम क्या करते हैं, सब कुछ hyper extend, neck is hyper extended, right? So because of that, if you have atlantoaxial dislocation, that is called as Grisel syndrome. Okay, right. Shall we go into trauma now? So what is this fracture that I am showing you? These are the Leefort fractures. 3 Leefort fractures होते हैं अपने पास. Remember Leefort 1, 2 and 3. But what is the one thing that needs to be involved in all of them? The common thing is सब में एक चीज होना चाहिए, not zygoma but pterygoid plate fracture. That is must to call it Leefort. ठीक है? So this has to be there. Plus we will see orientation. If I see horizontal है, maxilla से जा रहा है, it is your type 1. What is the complication here? Very nice. There is a Guerin sign. So why I brought Leefort here is the third G. क्या दो चीजें देखी? Gradenigo syndrome. We saw Grisel syndrome, and now we see the Guerin sign. So I just brought them together so that you don't mix them up. Okay. So Guerin sign में क्या होगा? Greater palatine artery की इंजरी होगी, because of which you will have palatal hematoma. Greater palatine artery hematoma. G for Guerin, G for GPA. Second में क्या हो रहा है? You have a pyramidal fracture, right? So pyramidal, which is reaching almost up to the skull base. And third में क्या है? पूरा disjunction. So this is called as craniofacial disjunction. पूरा ही अलग हो गया. So out of these, if I ask you, which can not have CSF rhinorrhea? One, right? One कहीं पास में ही नहीं है. Whereas 2 and 3 are both involving skull base. So 2 and 3 will have CSF rhinorrhea. So इसी train of thought पे CSF rhinorrhea कर ले, खत्म फटाफट. Okay. So what is the most common site of CSF leak if I ask you overall? This we already have discussed. This is cribriform plate. Very nice. Most common traumatic is what? Roof. Fovea ethmoidalis. Leaford कौन से में CSF leak मिल सकता है traumatic? 2 and 3 है ना, 1 में नहीं मिलेगा। इन्वेस्टिगेशन ऑफ चॉइस टू कंफर्म CSF लीक। सो आपके पास आया कोई पेशेंट कि मेरे पास ना टी पॉट डिस्चार्ज, इसको बोलते हैं टी पॉट, की जैसे ही मैं नीचे मुड़ता हूँ आई एम हैविंग डिस्चार्ज, सो दैट इज कॉल्ड एज टी पॉट डिस्चार्ज। आपने बोला ये टिश्यू रख, तो टिश्यू रखा तो उसमें खून भी आ रहा है, CSF भी आ रहा है, इट इज फॉर्मिंग व्हाट, इट इज फॉर्मिंग दिस हेलो और टारगेट साइन। सो नाउ यू सस्पेक्ट कि अरे इसको तो CSF राइनोरिया होना चाहिए। सो नाउ व्हाट विल यू टेल हिम कि ठीक है मैंने मान लिया इट इज CSF राइनोरिया, नो, to confirm that it is CSF leak, I will not do CT. I will do what? I will do electrophoresis. So I will do a beta 2 transferrin. So remember, the study to see beta 2 transferrin is electrophoresis. अब मैं बताती हूँ एग्जाम में हम कहाँ गलत जाते हैं। एग्जाम में वी आर सो सीधा इन आर, मतलब हमने ऐसे पढ़ लिया है कि बीटा टू ट्रांसफर एंड एनी टाइम वी विल सी इलेक्ट्रोफोरेसिस वी विल नॉट रजिस्टर, सो व्हाट द एग्जामिनर्स विल डू, they'll give electrophoresis in the option. You will be so bent on looking for beta 2 transferrin that you will not read the options carefully and you'll just mark something, right? So be careful. And beta 2 transferrin कैसे पता चलेगा, प्रोटीन देखना है इलेक्ट्रोफोरेसिस से, right? Getting my point? सो आती हुई चीज गलत नहीं करनी, यू हैव टू मेक श्योर यू नो दैट थोड़ा सा लेटरल थिंकिंग, इट विल ऑलवेज नॉट बी अ डायरेक्ट वन लाइनर व्हाट यू स्टडीड एंड दैट केम इन द एग्जाम, राइट? सो इट विल बी समथिंग दैट यू हैव टू एनालाइज अ बिट, assimilate a bit, right? So do that. Whereas if they ask to investigation of choice, fine, I have confirmed that it is indeed CSF. Now to confirm कि कौन सा कहाँ से site है, and it is definitely where the leak is happening from. Now it will be something called as a CT cisternography. So what I do is I will put iodinated contrast into the cisterns. How? By doing a lumbar puncture. So I do a lumbar puncture and put iohexol. Iohexol is the dye that I will put. That will go from the subarachnoid space into the CSF cisterns. So what will I see? Can you see how it is all white, white? So I will see कि okay यहाँ पे fracture मिल गया, and through that I will see the white dye leaking out. Is that confirmatory? That अच्छा site भी पता चल गया, cause भी पता चल गया, and it is definitively leak, right? So this is what is there. Investigation of, see you have to read. अगर ये पूछ रहे हैं कि confirm बताओ कि CSF है या नहीं, to investigate, like how I framed it. Investigation of choice to confirm CSF leak, beta 2 transferrin. Investigation of choice for CSF leak, CT cysternography. Location, CT cysternography. Got it? What is this though? This is MR cysternography. So MR cysternography, do I need to put contrast or do I have fluid only which is T2 hyper intense and can act as contrast? So here I can just do a heavily T2 weighted image like MRCP. So I can do a heavily T2 weighted image and I can see white fluid coming out. Okay, so here the advantage is non-invasive. कोई lumbar puncture कुछ नहीं करना. Okay, but still CT is preferred. Why is CT preferred than MRI जबकि वो invasive है? Because it tells you correct, it tells you fracture side, it tells you about the bones, right? So MRI nahi batayega. Heavily means I do a very high T2 weighted such that the fluid becomes very white. Okay, okay, one more G then on the lines of Guerin sign we have one more G. What is this? बैटल साइन है, तीन तीन है जहां पे जिनके कान के पीछे रेड रेड है, तो सीधा बैटल पे मत आओ, ये क्या है? देयर इज नो हिस्ट्री ऑफ ट्रॉमा हियर. Yes. So this is called as Greisinger's sign. So what is the, so will you, so this is छोटी कॉपी, हाँ छोटी कॉपी में चारों जी लिखोगे और उनको कंफ्यूज नहीं करोगे, ठीक है? So the Greisinger sign, wherein what you have, this is a complication of CSOM again, wherein you have lateral sinus thrombosis. So when you have sigmoid or lateral sinus thrombosis, you will see that there is this ecchymosis here. Oh, thank you so much. रोज ऐसे ही तो होता है, आज ऐसा क्या हो गया? This is ecchymosis, right? So you will see ecchymosis here, which is Greisinger sign, which is lateral or sigmoid sinus. रोज अच्छी नहीं होती. I don't know how to take a compliment. Okay, so the Greisinger sign, lateral sigmoid sinus thrombosis, wherein you'll see hyperdensity here, right? In the sigmoid sinus, you'll see white hyperdensity. Okay, अब ये चीज, एक चीज ना जो हर कोई कंफ्यूज करता है, सिंग सम ईएनटी फैकल्टी का लेक्चर, आई विल नॉट नेम, बट उन्होंने क्या किया था, उन्होंने सुपीरियर सजाइटल साइनस की इमेज दे दी एंड ही और शी वाज सेइंग कि दिस इज एम्प्टी डेल्टा साइन. ओके, सो दिस इज बेसिकली दिस इज लेटरल साइनस, दिस इज नॉट सुपीरियर सजाइटल, ओके, दिस इज लेटरल साइनस. जब आप सुपीरियर सजाइटल साइनस देखते हो, वेर यू विल सी द ट्रायंगल, रिमेंबर अगर एनसीसीटी करते हैं तो वी विल सी white white thrombus, okay, that is called delta sign where thrombus appears white. But when you do a CCT, what will happen? The periphery will show enhancement but thrombus will not show enhancement. तो उसमें नाम देते हैं एम्प्टी डेल्टा साइन. ठीक है, ये मैंने टॉप 100 इमेज में भी दिखाया शायद. दिस इज एम्प्टी डेल्टा साइन. गॉट इट? सो रिमेंबर दिस इज योर सुपीरियर सजाइटल, वेयर एज ये जो जहाँ पे आपको ये पीट्रस एपेक्स मिल रहा है इसके पास जो है, दिस इज योर सिग्मोइड साइनस, एंड दिस इज ग्राइसिंगर इज सिग्मोइड साइनस थ्रोम्बोसिस, नॉट सुपीरियर सजाइटल साइनस थ्रोम्बोसिस. ओके, सो जस्ट टू शो योर पैटर्न अप्रोच, इफ यू सी कि इतना आयरन आउट अपीयरेंस है, this is called as ironed out appearance. What is this? Correct, this is edema of acute mastoiditis, right? So this is your acute mastoiditis edema. On the other hand, जब आपको ऐसा ecchymosis in a history of trauma patient you get it, this was your first instinct battle sign, which represents middle cranial fossa fracture. And what is the vessel which is injured? Why do you get battle sign? Pathophysiology क्या है? So you have the posterior auricular artery जिसके along bleeding होएगी, right? So posterior auricular artery के along bleeding हो जाती है, injury हो जाती है. So this is about that. One more complication of CSOF, whenever you see ring enhancing, like I have told you, हाँ without history नहीं बता पाओगे, history के साथ बताएंगे. Good, this is abscess. ठीक है, you will revise all G's on your own. Okay, so this is your ring enhancing lesion. So depending on the location we have two things. अगर यहाँ पे है, लास्ट ईयर का नीट का सवाल, अगर यहाँ पे है, what abscess is this? बताओ. ये ब्रेन स्टेम हो गई. सो ब्रेन स्टेम के पीछे क्या है? सेरिबेलम. सो दिस इज योर सेरिबेलर एब्सेस. ऑन द अदर हैंड व्हेन यू हैव हियर, दिस इज योर सेरिबेलम, राइट? तो आगे है, दिस इज योर टेम्पोरल लोब. सो डू नॉट मिक्स देम, एनाटॉमी को गलत नहीं करना. दिस इज टेम्पोरल एब्सेस, इज सेरिबेलर एब्सेस. एब्सेस पर से सेम लगेगा, लोकेशन एनाटॉमी से डिस्टिंग्विश करना है. ओके, एंड बोथ ऑफ देम, कैन बोथ ऑफ देम बी कॉम्प्लिकेशंस ऑफ मास्टोइडाइटिस? यस, दोनों ही ईयर के पास ही है, राइट? सो वी कैन हैव टेम्पोरल आल्सो, वी कैन हैव सेरिबेलर आल्सो. सो ये एकदम गेस नहीं मानना, यू हैव टू सी की साइट क्या है एंड देन मार्क करना है. ओके, ट्रॉमा में जाए और ट्रॉमा डिस्कस कर रहे थे. व्हेन यू सी दिस, ये क्या है? सेप्टल हीमेटोमा, राइट? सो यू विल सी कि दोनों तरफ है. दिस कैन कॉज नेजल ऑब्स्ट्रक्शन. हाउ डू यू मैनेज सेप्टल हीमेटोमा? यू हैव टू डू इंसिशन एंड ड्रेनेज, रिमूव करना है. ट्रीटमेंट इज IND. सेप्टल फ्रैक्चर्स कर ले. सेप्टम के फ्रैक्चर दो टाइप के होते हैं, झारजावे एंड शेवले. झारजावे इज व्हाट? कोई आगे से मुक्का मार गया नाक पे, septal injury. So this is when you have somebody जो आगे से blow कर रहा है, right? So this is gonna be parallel, alright? So ऐसा आएगा parallel. Fine. So remember this is frontal. जब कोई नीचे से मार गया, तुम नीचे से मुक्का मारा, what is this? This is chevalier, right? So this is your vertical, which is gonna be from below. Fine. So just remember this. इसमें ना type 1 और type 2 है. So it is उल्टा. Chevalier वावल में पहले आता है. So C is type 1 and Jarjave is type 2. ठीक है, तो ये बस अगर टाइप 1 टाइप 2 भी पूछता है तो फाइन. सो जस्ट रिमेंबर दिस. ओके, हाँ, शेवलेज चिन ना, वो सिंपल है, वो नीचे. ऑन द अदर हैंड ये क्या है? मोस्ट कॉमन फेशियल बोन टू बी फ्रैक्चर्ड, नेजल बोन है ना. कैन यू सी यहाँ पे नाक का फ्रैक्चर हो गया, नेजल बोन फ्रैक्चर. हाउ डू यू मैनेज नेजल बोन फ्रैक्चर? उस पर क्वेश्चन आ सकता है. तो बंदा तो तुरंत ही आ गया, इमीडिएटली द पर्सन हैज कम, देयर इज नो एडिमा, व्हाट डू यू डू? Immediate reduction, right? Treat it. But if there is edema which has set in, delayed presentation हो गया, आपके पास 10 दिन बाद आ रहा है कि डॉक्टर साहब यहाँ पे सूजन हो गई. Now what do you do? अब तो रुक, wait for 1 week more. You wait for edema to settle, edema को resolve होने दो, and then you want to treat, then you want to reduce करने के लिए we use two instruments. What are these two instruments? See, I am doing instruments also. What is this? जब सीधा सीधा forceps है, उस पर कुछ ऐसा सा twist नहीं है, this is called as ash septal forceps. Very nice दिया. So this is ash septal forceps. On the other hand, can you see यहाँ पे एक ऐसा plate है, this is your Walsham forceps that you are seeing. So we use these two forceps, ash and Walsham. अगर ऐसा प्लेट बन गया वॉल्शम में, अगर सीधा सीधा फोर्सेप है तो एश सेप्टल फोर्सेप है. ठीक है, अब ऐसे ही उठा के नहीं पूछेंगे, दे विल गिव यू सम हिस्ट्री की यार नेजल फ्रैक्चर था एंड देन यू आर यूजिंग दिस फोर्सेप, राइट? तो भी बता पाओगे. व्हाट इज दिस? लास्ट ईयर के एफएमजी एग्जाम में आया था, उससे पहले नीट में आया था. सो आर यू सीइंग दिस? ये क्वेश्चन प्रूफ है कि नीट और एफएमजी का क्वेश्चन बैंक सेम है. लास्ट ईयर नीट का सवाल, इस साल एफएमजी का सवाल. This is teardrop fracture. Literally questions lift होके आते हैं FMG में. The teardrop fracture wherein you have the floor का fracture, orbital floor fracture, and what is the problem here? Problem is inferior rectus bichara can go here. So this has one complication wherein the inferior rectus can get trapped, है ना. तो इसको इसलिए बोलते हैं ट्रैप डोर फ्रैक्चर, एंट्रैपमेंट हो सकता है. सो दिस पेशेंट if the patient comes to you with diplopia, then you know कि कुछ ना कुछ गड़बड़ हुआ है, right? So this is your teardrop fracture. Last thing, what is this kind of a fracture? मैं start नहीं कर रही. ट्रॉमा हुआ है, bleeding from ear हो रहा है. What kind of a fracture is this? Yes, so temporal bone, this is along the temporal bone. Do you remember this? Those of you who have seen my previous classes. So ये temporal bone का petrous apex है. When it is along, parallel है, it is longitudinal bone, right? So remember, along, it is longitudinal, right? So this is something that you need to know. बहुत 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 सवाल आते हैं. So the easiest that I can make for you is along, right? So when you have a fracture, it is going like this. This is black middle ear. Do you all understand कि middle ear में air है? हाँ, inferior rectus. Yeah. So यहाँ पे air है. So will this go along middle ear? Yes, it will go along middle ear. तो इसके साथ साथ do you agree इसमें ossicular injury भी हो जाएगा? तो conductive hearing loss होगा या फिर sensory neural? CHL. So this is the question which comes, and I have seen people confuse these two, including myself. जब मैं बहुत छोटी थी और मुझे along नहीं पता था, I used to confuse this a lot. So now you will not confuse because you know कि longitudinal is along and it will cause middle ear problem. So it will have conductive hearing loss. Will it have inner ear involvement? No, it will have ossicular injury. It will have tympanic membrane. So बच गया क्या? Transverse. Transverse will be perpendicular. So this will involve inner ear. तो nerves सारी जाएंगी. SNHL, facial nerve, सब कुछ इधर जाएगा. Which is more common? Along, right? So longitudinal is more common. So this is 80%, whereas transverse is 20%. Okay, so this is 80 and 20, and which will have CSF otoria? Again, along, right? So sab kuch, when in doubt, along. So this will also have CSF otoria more commonly. Okay, got it? So this is about longitudinal versus transverse. तो ये क्या है बताओ बच्चों? It is along. This is longitudinal fracture of temporal bone. On the other hand, when you see ऐसा देखो, ये inner ear है ना. तो एक बार temporal bone का anatomy भी समझ लो. ये mastoid hair cells हो गए काले काले. ये middle ear हो गया. So this is lateral, this is medial, correct? So laterally we have the middle ear which will have ossicles, and this is the inner ear, right? So inner ear you will see this, and can you see one fracture along inner ear? So this is your transverse. Do you see how it's perpendicular? So this is your transverse fracture, and this will have more commonly inner ear injury. So SNHL हो जाएगा, facial nerve palsy हो जाएगा. This is all which will happen here, not along. Okay, going on to nose. When you see foul smelling nasal discharge, तीन चीजें. अगर छोटा बेबी है, चाइल्ड आया है, अकेले खेल रहा था, अकेले खेलता हुआ बच्चा क्या करके आएगा? Foreign body. The कुछ ना कुछ foreign body नाक में डाला होगा, and who would have forgotten. Okay, so this is secondary infection, foul smelling nasal discharge. अगर adult patient है, foul smelling nasal discharge, two things that you want to know. Roomy cavity है, so this can be atrophic rhinitis, or again roomy cavity है with nasal crusting. What is the third thing that you want to know here? Rhinosporidiosis और rhinoscleroma. Rhinoscleroma, ठीक है. तो ये तीन चीजें हैं. So child foreign body तो ठीक है, foreign body we will see. On the other hand, when you see roomy nasal cavity with crusting, क्या word बोला? On examination, roomy nasal cavity with crusting, and you have something called as merciful anosmia. There is very bad smell, foul smelling discharge, but patient का smell आ रहा है. Patient doesn't know only. So this is much like neurotrophic joint. This is much like neurotrophic Charcot joint. The patient को तो कुछ पता ही नहीं चल रहा. He is not having pain, but when we look at the joint, it is distended, it is destroyed, right? So patient doesn't feel because उसकी nerves ही काम नहीं कर रही. Similarly here, the patient can't smell only. So that is called merciful anosmia. Like बेचारा को smell ही नहीं आ रही. Okay, so that's why merciful. What will you find on the CT? CT में you will find that the cavities are very roomy. Look at all the turbinates and everything has become so atrophic, right? That is what the term suggests. So merciful anosmia. Treatment क्या है? So you want to make the roomy cavities less roomy? Yes, very nice. So when they ask to treatment first, it's what Dia has said. So that is going to be alkaline nasal douching. So remember, youngs पहले नहीं करेंगे. The first thing we will do is alkaline nasal douching. Following that we do youngs, modified youngs या normal young. कभी पूछे तो modified ही करेंगे obviously. We do modified young surgery where I will keep the nasal cavity small, है ना, उसको छोटा कर देंगे. So they can give you image something like this. Okay. Apart from that, is there something called as Lauterberg procedure? Yes, तो Lauterberg procedure भी होता है जिसमें हम टेफ्लॉन डाल देते हैं नाक में. I just know इतना about that. Okay, so this is also something that they can ask where we put Teflon here. Fine, so this is all that you need to know about atrophic rhinitis. On the other hand, when you see roomy cavity and crusting है, but instead of all this, I find कि इतना बड़ा सा नाक है. What is this? This is rhinoscleroma. So rhinoscleroma and all right. What is the cause of this thing? Cause of atrophic rhinitis? Klebsiella ओजानी, राइट. सो यहाँ पे क्लेप्सियला ओजानी है एंड यहाँ पे क्लेप्सियला कैसा है, यहाँ पे है क्लेप्सियला सेम नाम में है राइनोस्क्लीरोमाटोसिस, है ना. तो ये तो नाम से ही पता चल गया. सो देयर आर दीज थ्री स्टेजेस ऑफ राइनोस्क्लीरोमा: एट्रोफिक स्टेज, ग्रैनुलोमेटस स्टेज एंड साइकेट्रिशियल स्टेज. सो इन तीनों स्टेज में ना अलग अलग चीजें मिलती है. सो इन द एट्रोफिक स्टेज वी विल सी समथिंग कॉल्ड एज कारपेंटर ग्लू discharge, right. We'll see carpenter glue discharge here. Granulomatous stage में क्या मिलेगा? What we are seeing here. So this is a very large nose which looks like a horse or a zebra. तो कंफ्यूज हो गए जो बना रहे थे नाम, उनको लगा यार हॉर्स जैसा भी लग रहा है, जीब्रा जैसा भी लग रहा है, तो नाम डाल देते हैं हीब्रा. सो उन्होंने रख दिया हीब्रा साइन. व्हाई गेट कंफ्यूज, लेट्स कंबाइन हीब्रा साइन. साइकेट्रिशियल बन गया तो इसको नाम दे दिया टैपिर नोज, राइट. सो दिस इज टैपिर नोज. ठीक है. सो ये तीन नाम है यहाँ पे ऑफ राइनोस्क्लीरोमा डिपेंडिंग ऑन द stages. Okay, so these are the three stages, these are the three names. A few more facts about rhinoscleroma. So Klebsiella rhinoscleromatis ग्राम नेगेटिव बैसिलाई है एंड हिस्टोपैथ में क्या मिलेगा? दो चीजें. एक तो मिलता है मिकुलिक सेल्स, ठीक है, तो मिकुलिक सेल एंड व्हाट एल्स, या रसल बॉडीज. सो मिकुलिक सेल मिलेंगे एंड रसल बॉडीज मिलेंगे. ठीक है, ऐसा ऐसा एम्प्टी सेल्स मिलेंगे. फाइन. थ्री स्टेजेस वी हैव डन, हीब्रा नोज वी हैव डन. ठीक है, तो ये है अपना जो आपको पता होना चाहिए फॉर राइनोस्क्लीरोमा. ट्रीटमेंट कैसे करेंगे? व्हाट इज तापिर का मीनिंग क्या होता है? Tapir ka milk, tapir has a meaning or what? I have not heard this name. What is the treatment? Animal. You guys know about that? All of you guys know. God, I should not have asked. सुना है क्या? Tapir is a commonly used animal है. Anyways, so treatment is what? Strep plus tetra, है ना. तो rhinoscleroma S से है, so strep plus tetracycline. Fine. So this is what you need to know. All right. Okay. Fine. Don't show off now. Okay. So this is that. What is this? When you have a mulberry kind of mass which is coming, so rhino से confuse कर सकते हो, rhinosporidiosis. So this is not scleroma. This is rhinosporidiosis. Okay. What is the cause of rhinosporidiosis? चलो ये बताओ. Is it a protozoa? Is it a fungus? Is it a drip agent? या सो दिस इज कॉज्ड बाय राइनोस्पोरिडियम सीबेरी. तो शुरू में लगा फंगस है, फिर लगा प्रोटोजोआ है, फिर बोला नहीं, व्हाई कीप इट सिंपल. सो देन दे कॉल्ड इट दिस एजेंट. ट्राई एंड प्रोनाउंस दिस. So Dermatocystidium, rosette agent, Ichthyophonus and Sorospermum. This is what it is. Okay. So now, if you really want to give complex to somebody, आपको लग रहा है ना कि ये बंदा बहुत पढ़ रहा है, तो उसको जाके ना एक बार ये सुना दो. यार ये नहीं पढ़ा, ये बहुत इंपॉर्टेंट है, प्रीवियस क्वेश्चन. ऑलराइट, तो ये नाम बोल दो एक बार. बस इतना सा कर दो, दैट विल बी इनफ. और कुछ कुछ सेडिस्ट लोग होंगे, दे विल डू दिस वन नाइट बिफोर द एग्जाम. कल एग्जाम है और वो ड्रिप एजेंट का नाम बोलेंगे, है ना. यार ये तो बहुत इंपॉर्टेंट, ये नहीं सुना. ऐसे लोग होते हैं दुनिया में, राइट. सो दिस इज योर ड्रिप एजेंट व्हिच इज राइनोस्पोरिडियम सीबेरी. इसमें एक बजवर्ड दिया होगा. व्हाट इज द बजवर्ड? दैट दे विल बी अ पर्सन फ्रॉम तमिलनाडु हु इज स्विमिंग. तो तमिलनाडु में कोई स्विमर मिल गया ना, तो उसको राइनोस्पोरिडियोसिस ही होगा. ओके. एंड देन यू विल हैव दिस एंडोस्पोर्स, राइट. तो ये हो गया एंडोस्पोर्स. फाइन, दैट इज इट. उसके अलावा कुछ जानने की जरूरत नहीं है. ओके. सो ये एंडोस्पोर दिख रहा है हिस्टोपोर में. फाइन. नहीं ना, फंगस भी नहीं, प्रोटोजोआ भी नहीं, ड्रिप एजेंट है. ये नहीं समझ आया? ये ड्रिप एजेंट है. ऑलराइट, तो ये पूरा. ओके. व्हाट इज दिस? वन मोर राइनो. यस, दिस इज राइनोफाइमा, है ना। तो मैंने आज सब कुछ आपको कंफ्यूज करके एक साथ दिया है। यू हैव टू राइट दिस इन छोटी कॉपी। ओ पूरी, ओ गॉड, दिस इज राइनोफाइमा, राइट। इट डज एक्चुअली लुक लाइक दैट। ही डज अ राइनोफाइमा, हाँ, कभी सोचा नहीं, राइट। सो राइनोफाइमा, व्हाट इज दिस? दिस इज अ टाइप ऑफ रोजेशिया। डू यू रिमेंबर रोजेशिया? व्हेन रोजेशिया becomes very severe and you have this diffuse sebaceous gland hypertrophy, yeah, sebaceous gland hypertrophy. Okay, so that is rhinophyma, where it becomes so big. Yeah, we can do CO2 laser to ablate this. Okay, तीनों rhino हो गए. Finally, epistaxis. Epistaxis में we have external carotid, we have internal carotid. तो normally कौन सी artery आती है? Most arteries from external carotid. Do you guys know from about Little's area? We all read about Little's area since we were very little, no? तो Little's area की क्या क्या branches है? Mostly branches of ECA. Facial artery की कौन सी branch? Superior labial artery. फिर GPA. GPA के along क्या हो रहा था बताओ बच्चों? कौन सा G था? गुवेरिन, है ना। गुवेरिन साइन अलोंग जीपीए फॉर लीफोर्ड 1. वेरी नाइस. सुपीरियर लेबियल ग्रेटर पैलेटाइन. लेसर पैलेटाइन अगेन ब्रांच ऑफ मैक्सिलरी आर्टरी. दूसरी मैक्सिलरी आर्टरी से कौन आएगी? स्फीनोपैलेटाइन, विच इज द मेन, जिसको नाम ही देते हैं आर्टरी ऑफ एपिस्टैक्सिस. It is sphenopalatine, right? So this is your mainstay artery of epistaxis. ICA से दो branches है from ophthalmic. We have anterior ethmoidal and we have posterior ethmoidal. So the only question is which branch does not contribute to Little's area, and all of you have already told me posterior, not a part of Little's area. ठीक है, so दो questions आते हैं. Little area की कौन नहीं है? Posterior. And main कौन है? Sphenopalatine. How do you manage? That will depend whether you have anterior epistaxis, posterior epistaxis. Which is more common? Obviously anterior. So बच्चे क्या करते हैं? nose pick करते हैं. So nose picking is the most common cause of anterior epistaxis. So this is trivial trauma, right? So ये कैसे हो जाता है? Trivial trauma से. Is the bleeding controlled very easily? हाँ, usually it is controlled by this method only. What is this? सबने बचपन में किया होगा. This is your Trotter's maneuver, है ना. इसमें क्या बोलते हैं बच्चों को? कैसे करके बैठो, राइट. सो दिस ऑल ऑफ यू मस्ट हैव डन नो इन चाइल्डहुड, कि नोज को ये दबा के बैठ जाओ एंड लीन फॉरवर्ड. ब्लड को स्वॉलो करना है, स्पिट करना है? स्वॉलो नहीं करना, ठीक है. बोलो स्पिट आउट द ब्लड, ठीक है. स्वॉलो नहीं करना, वरना क्या हो जाएगा? स्वॉलो करेंगे, ब्लड विल गेट यूरीमिया हो जाएगा, है ना. सो नाइट्रोजन में प्रोसेस होगा, यूरीमिया हो जाएगा, गैस्ट्राइटिस हो जाएगा, राइट. तो फॉलो नहीं करना. सो ट्रॉटर्स मनूवर मोस्ट ऑफ द टाइम वी विल सी 80% तो इसी से कंजर्वेटिव से ही कंट्रोल हो गया, राइट. सो द एरिया रिस्पॉन्सिबल इज व्हाट? इट इज द लिटल्स एरिया, राइट. सो लिटल्स एरिया से बेसिकली यहाँ पे प्रॉब्लम हो रही है. ओके, वरना, वरना मीन्स अदरवाइज. ओके, वरना इज अदरवाइज क्या होगा? ऐसा. ओके, सो दिस इज लिटल्स एरिया. Everybody is learning thoda thoda Hindi. I'm not speaking too much Hindi, but whatever I'm speaking, you guys are comfortable, right? Okay, so this is anterior epistaxis. Posterior epistaxis, on the other hand, will occur in paracyclia, means puracyclia. Very good, Kirti. Okay, so this is seen in elderly. Then this will be, the cause will be hypertension. Okay. para ही गलत लिख दिया. So this is elderly patient with hypertension. Okay, and what else? What are I saying? Yeah. Does this have a good prognosis? Bad prognosis. This will have a bad prognosis, very poorly controlled. है ना? So this is about that. Now, how do you manage? It did not resolve with trotters. वरना क्या करोगे? अगर resolve नहीं हुआ, what will you do? Woodruff plexus, just read, no? On your own. Yeah, we will do packing, right? The person will go to hospital, will do packing. इससे भी resolve नहीं होगा. Which is the artery that you will ligate? That is the question which comes, right? So endoscopic ligation of sphenopalatine artery. ELPSA का नाम पता होना चाहिए, right? So endoscopic ligation of sphenopalatine artery is what is done, because that was our artery of epistaxis. ठीक है, तो TESPA भी बोल सकते हैं. ELSPA is what it's technically called. Okay, endoscopic ligation of sphenopalatine artery. ठीक है. या आई में पूरा you can ligate, ऐसा नहीं you can't ligate, but that will be your next step. First you want to do this. अगर इससे नहीं हुआ, then you want to go to this. Okay. Yeah, Woodruff is your venous plexus, which is responsible for posterior epistaxis, is it? So this is your Woodruff's plexus. So this is predominantly your venous injury. Okay, so this is about epistaxis. अब with 7 minutes to go, how do we start ear anatomy? बट वी कैन स्टार्ट एक्सटर्नल ईयर. थोड़ा थोड़ा तो कर सकते हैं. जो अंदर का मिडल ईयर है गंदा सा, वहां पे रुक जाएंगे. ठीक है, चलो शुरू कर दे फिर. नहीं नहीं, बातें नहीं करनी, विल स्टार्ट, इतना कुछ करना है फिर कल छूट जाएगा. सो दिस इज योर आउटर ईयर्स. अपने एक एक कान तो देखा ही होगा दुनिया में. सो व्हाट इज दिस, यहाँ पे दिस इज हीलिक्स. उसके जारा, जारा इज वेरी बिजी इस टाइम पे ना. जारा इज नॉट अवेलेबल यूजुअली. लेट मी सी, शी इज ईटिंग, पूरी डर्टी होके आएगी. सो दिस इज द हीलिक्स, दिस इज द एंटी हीलिक्स. ओके, फिर यहाँ पे कुछ चीजें पता होना चाहिए. दिस इज द ट्रायंगुलर फॉसा. यू ऑल हैव अ फॉसा हियर, ट्रायंगुलर फॉसा. दिस इज सिम्बा कॉन्का. व्हाट इज द इंपॉर्टेंस ऑफ सिम्बा कॉन्का? सिम्बा कॉन्का पे क्वेश्चन आ सकता है. दिस इज द एरिया वेर यू हैव मेस्टोइड. या आई एम ट्राइंग टू कॉल जारा but she's not picking up. This is mastoid tenderness. Okay, so mastoid tenderness will come here at Simba concha. Then you have this lobe, lobe या lobule. Lobule का importance क्या है? Lobule का importance is it is the last to be formed, है ना? Last to be formed embryologically. Last to form embryologically. कल ले आऊंगी पक्का. कल ले आऊंगी पक्का से. In the beginning of the class. This time she is not available actually. Fine. So this is lobe. What is this? Incisura. This is very important. So this is tragus and this is your incisura terminalis. Incisura terminalis का क्या importance है? Good. That here there is no cartilage. So what do we do? Can we take फायदा of this कि यहाँ पे cartilage ही नहीं है तो perichondritis नहीं होगा. So we can give an incision here. So that is called as Lampert incision. Right? So we give a Lampert incision here because there is no cartilage. So there is no risk of perichondritis. Correct? So this is about that. बस तो ये दो क्वेश्चन सिम्बा कौन का देख लेना, इंसिशुरा टर्मिनालिस देख लेना. फाइन. या फॉर एनी सर्जरी, यूजुअली इन चिल्ड्रन एनी टाइम मिडल ईयर को अप्रोच करना है तो. थ्री वेरिएंट्स. ये क्या है? दिस इज प्री ऑरिक्यूलर साइनस. राइट. तो यहाँ पे टैग भी हो सकते हैं, साइनस भी हो सकता है. नाउ टेल मी, एम्ब्रियोलॉजी ऑफ ईयर. यू ऑल हैव अटेंडेड एम्ब्रियोलॉजी वाला एमकेटी. हाँ. So today there is no homework from ENT. So अगर नहीं देखा, that is your homework. Okay. So if you have not seen MKT of embryology, that is your homework. Fine. बाकी नहीं है. So yes, this is arch. Arch and cleft दो दो चीजें नहीं हो सकती ना. Only arch. So this is arising from first and second arch via hillocks. Hillocks का नाम सुना है? 6 hillocks होते हैं. So basically what happens is first and second arch के hillocks जब fuse नहीं होते, then hillocks of His, correct. We will have this sinus when they do not fuse. Okay, so this is your preauricular sinus. What is this? इसका कोई पैथोफिजियोलॉजी नहीं है. दिस इज जस्ट अ नॉर्मल वेरिएंट. वी डोंट हैव टू डू एनीथिंग हियर. व्हाट इज दिस? हाँ, ये डार्विन, डार्विन का ट्यूबरकल. ओके, सर्वाइवल ऑफ फिटेस्ट, डार्विन्स. एंड व्हाट इज दिस? आमिर खान जैसा बाहर. दिस इज बैट ईयर. ओके, सो बैट ईयर में क्या हो जाता है? इनके पास एंटी हीलिक्स नहीं है. राइट, एंटी हीलिक्स नहीं है. करेक्ट. व्हेन यू डोंट हैव एंटी हीलिक्स, दिस इज विल प्रेजेंट एज बैट ईयर. जब ऐसा ईयर बन जाए कॉलीफ्लावर जैसा, व्हाट इज दिस? दिस इज व्हेन यू हैव हीमाटोमा, है ना. सो पेरिकॉन्ड्रियल हीमाटोमा, सब हीमाटोमा बन गया कार्टिलेज के नीचे. सो दिस इज बेसिकली बॉक्सर्स ईयर और ज़ारफ ईयर. ठीक है, बॉक्सर्स और कॉलीफ्लावर ईयर. Fine. So this is what happens in trauma. Okay, so this is what happens in trauma. Okay, ये भी बता दो फिर. When you see कि ऐसा ऐसा है, see, look at the CT first. Look at the image first. Are you guys still here? नहीं जा सब चुप क्यों हो गए? हाँ, what is this? The seeing external auditory canal में there are all of these bony projections. Correct. So this is not osteoma, but this is exostosis. So these are your sessile exostosis. When you see this bilaterally in external auditory canal, what is this disease called? This is called not swimmers, but surfers ear. Do not mix this up. ये किस में होंगे? सर्फ में होंगे. ठीक है. कभी भी दाग लगता है इन कपड़े, what do you do? Exo means कपड़ों पे बाहर दाग लगा, so you use surf. Right, so that is how you will not get confused कि जब बाहर कपड़ों में दाग लगेगा, बाहर means outside, exo. So surfer's ear is exostosis. On the other hand, swimmer's ear क्या है? Swimmer's ear is हाँ, सर्फ एक्सेल. वंडरफुल. सर्फ और एक्सोस्टोसिस. ठीक है. I somehow don't think of the obvious mnemonic. I will think of some टेढ़ा route to that mnemonic. That is my problem. But somebody will be smart enough कि मैं ये तो सीधा सीधा mnemonic बनता है. So this is swimmer's ear. Swimmer's ear is when you have otitis externa. So this is your generalized otitis externa, right? So that is swimmer's ear. Okay, so that is what this is. I don't know that, Satya, just search that and let me know ना. So this is swimmers and surfers. Swimmers को और भी बोलते हैं. It's called as telephone's ear and any other name that you find. It is generalized otitis externa only. Okay, so इसमें आपको क्या मिलेगा? You will have perichondral inflammation and you will have some sort of dirty discharge which is coming. Okay, ये भी बता दो और we'll stop here. चलो फटाफट ये लास्ट कर लेते हैं. When you have black in the ear, black on the nose, mucor and diabetic black in the ear with ganda discharge, malignant otitis externa, cause fungal or bacterial. This you can't go wrong. This is pseudomonas, right? So the cause is pseudomonas here. Diabetic patient hoga, what will they give you? They will give you a very typical history that there is granulation tissue plus facial nerve palsy, है ना? तो ये दो buzzword है. With diabetic patient, it has to be malignant otitis externa. Pseudomonas patient में pseudomonas से होएगा. Drug of treatment, obviously anti-pseudomonal, so usually third generation cephalosporins are given, plus minus debridement if needed, right? What do you do? Any scan that you want to do for diagnosis? Yes, so we do a nuclear medicine scan, which is your technetium 99 scan for diagnosis. For prognosis or for basically following up the patient to see response to treatment, we can do a gallium scan, right? So gallium scan, remember, is used for follow up or to see treatment, basically whether it's responding or not. The other thing we can do is ESR, right? So ESR कर सकते हैं, gallium scan कर सकते हैं to see response. But for diagnosis, we do technetium scan, right? Anybody knows anything else about malignant otitis externa? When actually I was preparing for AIMS ना, तब ये था hot topic. Every exam you do, NEET देखो, AIMS देखो, इसके बिना question आता ही नहीं था, paper आता ही नहीं था. But since then they have stopped asking. Okay, so malignant otitis externa आ गया ना, facial nerve palsy I've written already. कॉन्सेप्ट कुछ नहीं. सो टेक्नीशियम 99 बेसिकली विल यूज इट एज इन्फ्लेमेशन. सो वो टेक्नीशियम 99 जहाँ पे भी इन्फ्लेमेशन है वहां टैग हो जाएगा. सो इज गैलियम. ओके, कल्चर वल्चर कुछ नहीं करना. इट कैन लीड टू स्कल बेस ऑस्टियोमाइलाइटिस. यस, ओके. बस यहाँ पे स्टॉप करें, कल यहाँ से कर लेंगे, या ये कर लो बस. दो एक्सटर्नल ईयर के और अपीयरेंसेस. व्हेन यू सी काला काला स्टफ, दिस इज कॉल्ड एज वेट न्यूज़पेपर साइन. लुक एट द इमेजिनेशन दैट पीपल हैव. इसको काला काला गंदा सा दिख रहा है, उसमें भी दे फाइंड समथिंग. Wet newspaper sign, and when you see black, this is Aspergillus niger, right? So this is your otomycosis by Aspergillus niger. And when you see this white stony stuff, this is keratosis obtuberans. This is not candida, guys. Candida नहीं है ये, keratosis obtuberans. Okay, तो ये है. Fine. बस इतने नाम कर लो. foramen sinus in external ear, just see no, two sinus and होते हैं, not very important. Fine. So this is about that. Will you be able to finish Bifire? What is Bifire? Okay, so now we will meet tomorrow. ठीक है. बाकी आज रात को we have one radio class, very nice, at 11:30, quite late, 11:30. I'll see. Will I be able to finish before FMG? So 3 modules will finish. No, 4th module पूरा नहीं हो पाएगा December वाला. So not all subjects, but most subjects will do. Okay. Right. So tomorrow we'll continue from this ear and larynx and pharynx. कल ENT पूरा खत्म हो जाएगा. No need to do anything from ENT apart from this. Just आज embryology वाला पढ़ लो. Link to the group I will just post for those of you who have not joined. And बाकी वो homework खत्म कर लो. PEDS वाला सारा. Those were a lot of links, right? Do that. Yes, it's fine. Your approach is fine where you add stuff to these notes. But make sure that ये वाला सारा कर रहे हो आप. Okay. एक second, I'm just posting the link. All right, so I'll see you all tomorrow. I will bring Zara tomorrow and we'll do PYQs of ENT tomorrow. Lots to do tomorrow. PEDS also. You can just click on the pinned message and you will be redirected to the group. Okay? ठीक है. हाँ, नोट्स पढ़ लो. सी पहले इतना कवर करो एंड देन एक्स्ट्रा करो, राइट? सो दैट इज द अप्रोच फॉर एवरीथिंग. इतना कवर करो एंड देन व्हाटएवर यू सी एक्स्ट्रा वो नोट्स है. या विल बी एबल टू कंप्लीट ENT टुमारो, आई थिंक सो. बिकॉज वी हैव डन अ बिग चंक ऑफ इट, सो कल ईयर और लैरिंग्स ही करना है मोस्टली, तो हो जाएगा। ठीक है, ऑलराइट, थैंक यू सो मच, बाय।